Hi, this is Jonathan Rosenhead, Jerusalem psychotherapist. This week's Torah and Psychology post of Matos-Masei is going to discuss resistance in therapy. At the beginning of Pashas Matos, we read about nedarim and shavuos. And what is the difference between a neder and a shavua? So the Gemara in nedarim explains that a neder relates to a chefza, an object. So the person makes a certain object forbidden to themselves. And a shavua relates to the gavra, the person, that a person makes an action forbidden to themselves. So for example, a person can make a neder that chocolate is forbidden to them. The object of chocolate is forbidden. Whereas they could make a shavua that on themselves that they cannot eat chocolate. The action of eating chocolate is forbidden to them. So perhaps it's a good idea, it's very healthy, it's good for one's physical health. But we're talking about mental health. So how does this relate to psychotherapy? So we see from this idea of nedarim and shavuos that a person can make something forbidden to themselves. And in psychotherapy, there can be topics or issues that a person makes forbids themselves from discussing. They're not willing to discuss certain topics. And this is because there's so much tension and pain and discomfort around these topics, and this can be related to perhaps to some traumatic experience. But what happens is that the subconscious mind makes a neder, makes a shavua, that it forbids the person from discussing these topics. And therefore in therapy this manifests as resistance in therapy, that the client is not willing to cooperate with the therapist. They're not willing to discuss certain issues. So how do we understand resistance? Is it positive or is it negative? From a psychoanalytical perspective, we would say that resistance is just a natural feature of therapy. As I said, it's the subconscious mind that protects a person. It pushes down certain topics so that a person cannot reach them, doesn't have to confront them, doesn't have to face the pain of certain topics. And therefore resistance is a defense mechanism. And the process of therapy is trying to reach these areas, reach these difficult and uncomfortable areas, to be able to discuss them. So it's natural that a person would show resistance. And therefore, if a client shows resistance, it's a message to the therapist that this is where they need help. This is exactly the point where they are struggling. And this is the point where the psychotherapeutic work needs to be done. And perhaps we could ask, is resistance a sign of regression or progression? So with this understanding, it's not that the client is trying to regress and that this resistance is a sign of regression. They're actually showing that they want to recover, they want to improve and move on, but they can't do it alone. It's too painful. And this is the message of resistance from the client to the therapist, where they say, please help me. And therefore the onus is on the therapist to identify, to recognize resistance, to help the client to understand, to interpret and explain the function of resistance, so that they can reach these difficult and painful topics, to discuss them, to remove the barrier that the subconscious mind has set up to forbid them from discussing and facing these difficult discussions and pain, and to be able to move on. I wish you a good Shabbos and keep well.